We can discuss what is excessive compulsive disorders. Dr. Les Linet.
Hi. This is a common condition. It's not, sometimes it's hidden. There are married couples, for example, where the spouse doesn't realize for years that his or her spouse suffers from this.
Are people born with excessive compulsive disorders?
Well, there is evidence of genetic contribution to it. So, and this is of course true with a lot of illnesses. So, in a sense, they may be born with some predisposition.
How would you define, to be used the term, what is, in your eyes, from a psychiatrist's point of view, excessive compulsive disorder? We're all a little excessive at times.
It's an excellent question because of that kind of thing. We use the word compulsion in a lot of ways that are kind of sloppy. For example, compulsive gambler is a term. But that's not a true compulsion. This is what a true compulsion is. A true compulsion is a behavior or a thinking pattern that is intended to neutralize some danger. So, I have a patient who has to have his towels and everything lined up just even, and he says he feels like his family is going to die if he doesn't do it. That's a compulsion. Compulsive liars, so to speak, or compulsive gamblers are not doing their, quote, compulsion because of danger. They're doing it for some gain. Obviously, gambling is supposed to give you a winning hand, or you win, and a compulsive liar gets some advantage if he can pull off his lie. So it's repetitive, and that's why it's used, the term compulsion is used, but it is not a compulsion. A compulsion, as I said, is an effort to neutralize a danger. People who go around the house and check the locks and the gas are doing a compulsion. Now, we don't call it obsessive compulsive disorder, though, unless it causes significant distress or impairment. So some people do these things before they go to sleep. They check the house. It is a compulsion, but if it's not causing impairment, we don't consider it a disorder. There's another condition that's related that I want to explain, and that's obsessive compulsive personality. And that, I think, is best illustrated by The Odd Couple. Those of you who remember, the characters Felix and Oscar. Oscar was the slob and Felix was the neat freak. Now, Felix, the neat freak, did not suffer from his neatness and his cleanliness. Oscar did. He was driving Oscar crazy, and vice versa. Oscar's sloppiness drove Felix up the wall. But just you talking now about Felix, the neat freak, the compulsive one, he didn't have obsessive compulsive disorder. It was not impairing his life. It was just annoying Oscar. But he could go to work, and he wasn't spending hours doing rituals. Often we use a criteria of at least an hour a day that the person is involved in a compulsion for the diagnosis of obsessive compulsive disorder. So, obsessive compulsive personalities don't suffer. They just feel better doing these things, and they do it.
Are there any known causes for excessive compulsive disorder?
Well, the streptococcal infection, pandas,
might be, but we're not sure.
At least is known to contribute in some cases to an exacerbation of symptoms of it. Probably genetic causes.
Is there any good treatments for excessive compulsive disorders?
Yeah, there is medicine and there's non-medication, and they're both effective. I'll give you a quick example. I saw a girl who was about 8 years old and her brother was about 4. Anything that her brother touched now became contaminated, and she would not touch it. She would not go to the bathroom that he had got into until her mother went in and cleaned it. Now, this was a big problem. The family was being sort of held hostage by the little girl's OCD. What I did, and this was a dramatic and very quick therapeutic story, I told Mom and Dad to bring in a pair of their son's underpants when they brought the kids in the next time. And we had her wear his underpants. She squirmed and was very uncomfortable, but by the end of the session she was okay, and after that she could touch him. It was important to treat this because not only was it tormenting the parents, but the boy he felt terrible. Anything he touched, it's like he was.
Why do you think it worked?
Leper. Isaac Marx is a British psychiatrist. He's the one who figured this out. He said that obsessive-compulsive disorder is lacophobia in the following way. A person with a phobia makes himself or herself feel better by not going into the phobic situation. So if you're afraid to go on airplanes, you don't fly, and you feel better. And what Isaac Marx said is that the way to treat this, though, is you've got to get on a plane. Or if you fall off a horse and you're afraid, you've got to get on the horse. You have to go do the thing that makes you scared if you're going to overcome it. You can go to a psychiatrist forever and talk about this forever, but until you, say, go into that elevator that you're afraid of, you're still going to be afraid. No matter how much you talk about the elevator, how it resembles something that scared you, got locked in a closet or something, you still have to develop a certain insight by living. In other words, you have to see that I can survive in the elevator. You get in the elevator, and I tell people, if they do this, that they must stay in the elevator. They can't go one flight, the doors open, and they get out and they feel like they did something. They didn't. All they did was prove to themselves that getting off the elevator is the greatest thing they could do. They have to stay in the elevator right up and down until they're sick and tired of this, and it's no longer scaring them. They've had enough. Then they can get off the elevator. Then they have learned that getting off the elevator isn't the great thing, that riding the elevator isn't really dangerous. So Isaac Marx said that the person who does the compulsion is making himself feel better, say by washing their hands, and as long as they do that, they feel better. But it's like staying out of the elevator. Nothing gets better, really. You just feel better for the time. He said they need to not wash. Now, I had one patient he came in, I brought in a bucket of mud. He was a hand washer, and I had him put his hands in the mud. He was very uncomfortable. He wanted to take the mud, he wanted to wash his hands. But I had explained this to him, and he endured this. Sometimes they'll go home and wash immediately, but I told him it was important not to go home and wash. He had paper towels so you could wipe off the mud and not drag it all over the place. But to go through the rest of the day without washing. I used the word insight before. There are different kinds of insight. I can explain to you